Oh, not yet.
Okay.
So hi, this is Jackie with Panama Relocation Tours with my special guest, Alicia. And this is just kind of an impromptu video that we decided to do because we've had so many technical problems before. I invited Alicia to talk about her experience being in one of the public hospitals shortly after she moved here. But first, let me explain to you that in Panama, there's two kinds of hospitals. There's private hospitals and there's public hospitals. So the private hospitals are for profit. Everything costs a little bit. It might be a little bit nicer hospital. The rooms are going to cost more. Doctor visits cost more. Emergency rooms going to cost a little bit more, but still really cheap prices compared to what you would pay in the United States or in other countries. And then the public hospitals, they are subsidized by the federal government. And so they're super affordable. It's only if you just need to go see a doctor because you have a stuffy nose or you got a hammer on your thumbnail and it's coming off. It's about $2 to see a doctor at the public hospitals, or $5 for a specialist. Even the emergency room, it's very well staffed, and Alicia can talk about that also. And then if you're admitted, it's going to be a no frills kind of a hospital. But, the nurses know what they're doing, the doctors know what they're doing, and you're going to get good care. So one other thing I want to mention is that because the private hospitals are a little bit more expensive, a lot of people want to get health insurance here in Panama to offset some of those costs. The problem is that right now in Panama, they are not writing new health insurance policies for people that are over 70. And if you have pre-existing conditions, they will write a new policy for up to 3 pre-existing conditions, but they don't cover them until 2 years after you got the policy. So basically for that 2 years, you're naked, more so to speak. You don't have any insurance. And also now the hospitals are requiring that you're vaccinated for COVID, or that you have a letter of exemption from your doctor on why you shouldn't be vaccinated. So the solution, if you can't get health insurance, is to use the public hospitals. They don't care how old you are. They don't care if you have pre-existing conditions, and they don't care if you've been vaccinated or not. So in Panama, the public hospitals are going to be the go-to place for a lot of people, especially if you're moving here on a tight budget, or if you just can't get insurance, or the public hospital might be the closest hospital to you instead of driving an hour and a half or 2 hours to get to a private hospital. So Alicia, talk about what happened and why you ended up in the hospital in Panama.
Okay. I want to thank you for having me here today too, Jackie. I moved here in February, almost a year now, February 2021. And in 1st of July is when I got sick, and we had not scoped out the hospitals, I want you to know, till this happened. So luckily I had figured out, I knew where the Pneumonia hospital was, only because I had been there to get a mammogram at a clinic that was right across the street from it. So I knew where it was. And anyway, so I get sick in the middle of the night. I end up, Jerry, my husband, takes me to the hospital, and that I had pneumonia and some kind of intestinal bug. And so, all over the world, they make you, you're in they call it a transition room until your COVID test, the one that takes 3 days to get. Yeah. So they have set up a makeshift room, and it wasn't what anyone would expect in the United States. I'll just put it that way. The only problem that I had there was the plumbing issues, because they had a lot of plumbing issues, as you know, here in Panama anyway. And I had, to walk quite a distance to go to the bathroom and carry everything connected to me. And so my doctor knew that when my test came back and I was negative, they transferred me over to a regular private room. It wasn't like decked out decoration wise, but it was a nice hospital bed. It had a window. It had my own bathroom. It had my own shower. I was happy for that. So, but as far as the care goes, even when I was in the transitional room, I had a nurse for everything. They were checking on me constantly. I had a problem with the language until I started feeling better. Then I realized I could communicate with my on my phone with my translator.
Mhm.
That worked out really good. I could figure out, oh, I have a headache. Can you give me something for a headache? Once they moved me into the room, my own private room, I felt like I was in luxury. Probably wouldn't have been that way had I went straight to that private room. I probably would have thought, boy, this isn't exactly like. But as far as the equipment they used, the doctors spoke good English. They explained everything to me thoroughly. I really felt like I was being taken care of and felt special. They made me feel special there. I walked when I started feeling better. I went for a walk with my husband, my first time out of my private room, and we walked back around to where the transition room was. You can't go in because it's the only doctors that are decked out with their spacesuits can go in there. But as we were turning around to come back, 3 of the nurses who worked on me walked out and recognized me right away. I didn't recognize them. They had masks on and they all looked the same to me, but they were waving, "Hey, Alicia, hi." It just made me feel good.
Yeah.
So I was in the hospital for 16 days.
Yeah.
The first round of antibiotics didn't do anything for my pneumonia. So they had to up the dosage of they called it resistant to pneumonia. And so I had to stay in another week. And that was difficulty because I didn't get to see my husband for 5 days. That was hard on me. Not understanding the language when I was so sick was also hard. I couldn't get it through that I needed something to sleep, and they didn't understand me. I kept, I need something to help me sleep, and they didn't get it.
Yeah.
But once I figured out the translator, I was fine. They treated me really good. So I had another set of X-rays done, and that one turned out to be good. So after 16 days in the hospital, by the way, I was in Aquilino Tejera Hospital in Panama.
Mm-hmm.
So
that's about an hour away from your house, right?
Yeah, about 45 minutes, but with traffic, it can be an hour. So we will always let an hour be our guide. So I got to tell you though, I was so worried about the price because we don't have insurance, and so 16 days in a private room, the whole bill, everything came to $1,280. I could not have had anything done to me for that price in the U.S. It would have been in the thousands of dollars.
Yeah, that wouldn't even do one day.
Yeah. So yeah, and I learned something too. I had what is called a transitory stroke. It's a mini stroke or a tiny little blip that goes off, and it just shut me off for a few seconds. But my husband, I was out, and then so he called the ambulance, and this was just January 10th. This happened. So he called the ambulance. So the ambulance was on the way. We have some friends here that he called for doctors. They came up and were helping me, asking me questions. A lot of it I don't remember. But anyway, I went, a hospital that my husband called was, I think he said $15, but it broke down on the way here. So then he said, "What should I do?" And they said, "Well, can you call a private hospital?" And he said, "Yeah, call a private hospital. Ambulance." And so that was $150 for a private ambulance. So they took me to the San Carlos Hospital.
Mm-hmm.
They did all of the tests, but they didn't have the equipment to do a CAT scan. They have the equipment, but they didn't have anybody certified to use it. So my doctor here Dr. Levy recommended they take me to Regional Nicholas Salino Hospital in the La Chirera.
Chirera. Mm-hmm.
Yeah, in Chirera. Yeah.
Yeah.
So I had to get in that hospital.
West of Panama City.
It's actually closer to me in Gorgona, where I live. So now we know there's a hospital there. We know where it's at. We drove by it the other day, and he said that's where it's at because I couldn't remember. So they took me there. I got my CAT scan. They analyzed it. There was nothing in the CAT scan that looked bad. So he explained to me that this does happen, and they've got me on medication now to if I have high cholesterol. I didn't even know I had. So they're thinking that's going to keep it from ever happening again.
Right.
So
all of that, Alicia lives in Gorgona, which is just a little bit east of Coronado, and there is a hospital in Coronado. Well, it's a clinic, really. It's not a hospital, but it closes at 9 o'clock. So if you have a medical emergency after 9 o'clock, you need to figure out where the other hospitals are that you might want to go to. So now you know about the one in La Chirera, you know the one in San Carlos, and you know the one in Panama.
Yes, and the one in San Carlos is very hard to find. You have to go. You come to almost like a Y, and it looks like a dirt road. Yeah. And everybody usually goes right because it's a road, but it's that road that you got to take to find the hospital. So it's really hard to find. Now we know how to get there, but I recommend people drive there and check it out before they need it. Yeah. And then again, the whole night with the ambulances and all of that, CAT scans, blood work, all the stuff they do is $400.60. And $265 of that was for my ambulance rides.
Yeah.
Did I say that right? Yeah. Transportation was over the amount of the hospital cost. So there you go. You can get a city, the local ambulance will take you anywhere you need to go for $15. That's what it costs for my ride from San Carlos to La Chirera. $15.
Yeah.
So there you go. It's not expensive in the hospitals here. I'm shocked about. I was so worried about what the bill was going to be when I was sick for so long and all the stuff. You know, they had me hooked up to everything.
Oh yeah, yeah. When I was in the hospital with COVID, I was in one of the private hospitals, and big difference because I was in the hospital for 9 days with COVID. I was on oxygen. Like you were, and I had IVs in both hands and all kinds of stuff they were giving me, and my bill was $15,000.
Okay.
So you can see, $1,200 for 16 days in the public hospital versus $15,000 for 9 days in a private hospital. Big difference. The good thing is you have a choice here in Panama. If when you're having a medical emergency, you just want to get to the closest hospital, whether it's private or public or whatever. You don't want to be picky about it. But if it's something that comes up, and like when I went to the hospital, I just went there to get a PCR test. I didn't think I had COVID. I'd been way too careful. There's no way I could have gotten COVID. I was there for a PCR test, and they checked my oxygen level, and it was like 82. And they said, if you want to live through the night, you need to stay here. So,
that's fun when you can't get oxygen to your brain. That was, another thing, because COVID and pneumonia have all the same symptoms. Yeah. So I was pretty sure I had COVID. I was trying to stay away from my husband. That whole day I stayed in the guest room. And I just didn't want to get anybody sick. And anyway, but when the test came back, the doctor even told me, he said, I don't think you have COVID. I think you have pneumonia, and we're going to go ahead and start treating you with it. Yeah. And they did. While I was in the transitional room, they were treating me for my pneumonia.
Yeah.
So I was just glad I didn't have COVID. Knock on wood.
Yeah, that's good. And, you had And I'm sure your room was not the designer, fancy, anything
Yeah,
about it at all, but you got the care that you needed to get well. That's what matters.
it was exactly. It was air conditioned, and I got to tell you, the bed was very comfortable. I had a really nice, comfortable hospital bed.
Yeah.
In both rooms. Even when I was in the transitional room, the beds they have at the hospital are comfortable for people who are sick and
Mhm.
are just laying around. Um, so the bed was comfortable. They ran, it was at a time when COVID was really rampant, right at that time.
Mhm.
Again, they were having another stir of it. It was right after, I don't know, some holiday here. Uh, I can't remember which one it was.
Right.
But anyway, that when weekend, the week that I entered the hospital, they were having lots of COVID people. So I was really
Yeah.
lucky. And even though I had to walk through the sick people to get to the bathroom, I was prepared for it. I had my husband bring me my COVID kits, and I had wipes, disinfectant spray, and my own toilet paper, and just everything I needed.
Yeah.
So, yeah. So I weathered through it.
I'm glad you got the care that you needed. And my experience was similar. The doctors that I had when I had COVID, they spoke perfect English. And even when I was in that transition room only for 2 hours while I was waiting for my PCR test, it just took 2 hours at that hospital.
Mhm.
And but the doctor came and he saw me and he said, "I'm pretty sure you have COVID. We don't need to wait for a test." And he got an IV starting. He said, "We're going to start treating you for COVID immediately."
Uh-huh.
Before I was even admitted to the hospital. So
So
the
they
doctor,
know.
they know, they've seen
Yeah.
enough people that they know. The good thing is they have the medications that they need to treat you. Now, they didn't have the CAT scan at that one hospital. They had the CAT scan, but no one available to do it. But
Right.
they
They
have
have, and they will in the next however long it takes to get certified to run one of those. That's
right.
what
So
they're working on.
they have the, whether it's a heart attack or stroke or pneumonia or COVID or automobile accident or whatever, they have the equipment to treat you at whether
Mhm.
it's a public hospital or a private hospital. And it's
Right.
not that you're going to get better care at one or the other. It's just the price is going to be significantly cheaper. The other thing
Right.
that you should all know is that the doctors that work at the private hospitals, whether it's a cardiologist or urologist or whatever it might be, they're required to work a certain number of hours every single week at the public hospitals. So whichever hospital you go to, there's a good chance you'll see the very same doctor.
Right.
It's not like you're going to get inferior care just
Mhm.
because you go to the public hospital. It's still going to
Mhm.
be very good care. It just might not be as fancy of a room as what
Mhm.
you would get if you were
I
in.
was comfortable. I had a nice pillow, and my
Yeah,
husband brought my favorite little blankie that my
yeah.
mother made me a long time ago. So I was comfortable, and to me, getting the care that you need and being comfortable and resting is the most
That's it.
important. Who
Yeah.
cares whether I didn't have a picture hanging on the wall? I didn't care at that point. I just
Right.
wanted to get
You
well.
don't have a dollar store picture or
Exactly.
a picture. It doesn't matter. You just want to get well. You want to just make sure that they know how to put in an IV, that the doctors
Hmm.
can speak English, that they have the
Hmm.
medications that you need when you need it, so that
Hmm.
you can get well. And they have all of that here in Panama.
And I had to go to Panama City to see what are they called? Pulmonary doctor
Uh-huh.
for my pneumonia. And we went to, I forgot the name of that hospital, but it was beautiful. I don't know if you've seen the hospitals in Panama City, Jackie, but they're very nice, very upscale. This,
Either the Punta Pacifica Hospital, which is the John Hopkins affiliate, or
uh-huh.
there's one that's really nice called Hospital Patia. And a lot of people don't know, but it's affiliated with the Cleveland Clinic.
Maybe
Um,
that was the one I was in. I
yeah.
don't know. His office was up in the,
My ophthalmologist is at Hospital Patia, and I've had 3 eye surgeries since I've been here, and the care was really good for all my
yeah.
eye surgeries.
So you don't have to wear glasses anymore.
No, I don't wear glasses anymore. Well,
I wanted
actually,
to,
I just No, I had an accident in Texas. I tripped on a blanket and I fell down the stairs in Texas before I moved here, and I detached the retinas in both of my eyes.
Oh,
And
goodness.
so, yeah, and my eyes were all messed up, and I had to have some special surgery in Texas called macular hole surgery, where they put a gas bubble in your eye so your eyeball can grow back together again.
Uh-huh.
And so that was in Texas. And then because of that surgery, I got a cataract in one eye. So that was done in Texas. And then I had complications with it after I got to Panama. But the doctors in Panama knew exactly what it was and exactly how to fix it.
Yeah.
And so now I don't wear glasses unless I'm driving.
Yeah.
Yeah.
I'm going to get that. I want to get, they won't give it to you on our insurance. We do have, we're on Medicare at home in the US.
Yeah.
So if I don't know what it covers, that's one thing I have learned that, if I need like a colonoscopy or a mammogram and all that, I get it for free in the US on my Medicare. There's no
Yeah.
cost. Here I have to pay for it. So you have to kind of weigh
You have to weigh it, but you don't
Yeah.
pay very much. So someone had asked a question of which hospital that you were in whenever you had pneumonia, and you were in the hospital in Panama, which is
Yes.
about 45 minutes, an hour west of Coronado area. That was the public
Yes.
hospital she was in.
Yes.
Now, when we've done tours, we've had several situations, maybe 4 situations in 12 years. People had some kind of a medical emergency. We had to get them to a hospital really quickly. And I think twice we've taken people to the hospital in Panama. One time
Okay.
a lady had epilepsy and she had a seizure right in front of me just before she got on the bus. So the hotel we were staying at, they got an ambulance right there and got her there. And she was in the emergency room for like 6 hours treating her for epilepsy. And her total cost for that was $69. Yeah.
Oh my goodness. Yeah.
Yeah. And, just imagine what that would cost where you are.
Yeah.
Another lady, she went to the San Carlos hospital, and I have an article about that one. And in her feet and legs had gotten all swollen up, and she wasn't sure what it was, but she didn't feel right. So she went to the San Carlos hospital, and they said she was severely dehydrated. So they gave her several IVs and some other medication because her blood pressure was also really up. And that was $4.50 for 4 hours in the emergency room with IVs going on. So you can see why, it's just one of many ways that you can live for less here in Panama. You can choose to go to the private hospitals, or you can choose to go to the public hospitals. Now, there's some situations in a public hospital. Let's say you needed to have open heart surgery for something. There could be a waiting list to have that done. You might have to wait 6 months. And if you can't wait, then you might use your Medicare and go back and have it done someplace else. Or if you have insurance, use one of the private hospitals. But if it's an emergency situation, then they're going to take care of it right away. We've had one lady had last year, in the middle of the pandemic, had to have emergency surgery at the public hospital in Chile. And she was in the hospital for 6 days, and hers was only $150. I don't know why she got maybe it was the pandemic and they felt sorry for her. I don't know. But her total cost for surgery and 6 days in the hospital was only $150.
Yeah.
So anyway, I'm glad you feel better.
Thank you. Me too.
I'm glad that you got the care that you needed. And thank you so much for sharing your experience with this.
Thank you for having me. I appreciate it.
We've got a couple of people that have jumped on to ask some questions. Let me see if anybody has a question for Alicia, then you can type it in and I'll ask it. So Allie says, Alicia, thank you for your very valuable info you're sharing with us. Hugs your way.
Thank you.
And Myra says, Alicia, I'm glad your experience was positive and that you're doing well.
Thank you. Thank you.
Another one shared, Michael. He was 1 hour in the emergency room in Panama, and it was $11.34. So can you imagine getting those kind of prices where you are? But it makes you think about why in the world is it so expensive in other
Yeah.
places, you know? Why
Yep.
in the world is it so expensive? It just doesn't need to be. Anyway, I just wanted everybody to hear Alicia's experience. We've tried a couple of times on some of our other conference calls and live streams to get her on, but we had technical problems, and the fault was really all mine. I was the problem. But we finally figured out how to make it work, and I just wanted to do a quick little video, and so Alicia could share her experience being in one of the public hospitals here in Panama. Thank you so much for your time, and have a great day.
You too. Bye-bye.
Bye-bye.